Welcome to the Illinois Perinatal Quality Collaborative Labor Management Support e-modules. These e-modules were made as a resource to support hospital implementation of the ILPQC Promoting Vaginal Birth, or PVB, initiative. The aim of the PVB initiative is for 70% of Illinois hospitals to be at or below the Healthy People 2030 goal of 23.6% cesarean delivery rate among NTSV, or nulliparous term singleton and vertex births, by December 31st, 2022. Our goals include increasing the percent of C-sections among NTSV births that meet ACOG SMFM criteria for cesarean, as well as educating physicians, midwives, and nurses on ACOG and SMFM criteria for cesarean, including labor management strategies. Hospital quality improvement teams participating in the PVB initiative are working on 5 key strategies to reduce cesareans among NTSV births, including labor management support. ILPQC partnered with Jessica Brumley, the co-creator of the Florida Perinatal Quality Collaborative, or FPQC, labor support workshops, completed by over 400 nurses and providers in Florida as part of FPQC's Promoting Primary Vaginal Deliveries, or PROVIDE initiative. Jessica is Director of Midwifery at the University of South Florida Department of Obstetrics and Gynecology, where she leads a team of 14 midwives and advanced practice nurses. She also serves as an advisor on the FPQC PROVIDE initiative. In August and September of 2021, Jessica and ILPQC worked together to offer 2 live virtual labor management support courses for nurses and providers in Illinois. These sessions were recorded and broken down by topic into this collection of 14 e-modules ranging from 6 to 21 minutes each. We are excited to share them with you. Now I will turn it over to Jessica.
And we talked earlier about how movement and position helps to make pain reduced and make for shorter labors. So obviously, if labor is shorter and contractions are more effective, then this can also help to provide comfort. So all the positions that we talked about before that are going to help with labor progress can also help with comfort. So, this next video, I wanted to show someone sort of upright and moving. We often think of music as something, that needs to be, super like calming, and but sometimes it's even more upbeat, and even dancing, can really be helpful. So I was just gonna, share with you this video of someone who was dancing in labor. And when she looks at the clock, you can see, because she's actually timing her contraction, because I think people often are like, she's not in labor, but she is. So I'm just gonna stop my share and we can watch the video.
All right, here she goes.
My water is breaking.
Baby on the way.
My water's got you through now.
She thinks it's funny. Why does my camera keep out focusing?
All right.
All right, here she goes.
I love that somebody says they use this and they show it to their moms. Yeah, like you can have fun, get up and move around. I feel like I've played all kinds of music in labor and births before, you know, totally just depending. You can, you know, I can be listening to the Hamilton soundtrack or a little Bob Marley or some Christian rock, like totally depending on, you know, the mood of the room and what they're feeling. So definitely want to you know, go with the flow of the patients. And all these positions of, you know, of using the birth ball, right? Progress and comfort. We mentioned hydrotherapy earlier. I love how they, in this picture, you see her sitting on a chair. We have some shower stools, and so you can like position yourself so that way you feel the water where you need it. Maybe it feels really good for the water to be flowing on the belly. Maybe you really need it on your back. Using something like a shower stool will probably mean that she can be in there a little bit longer because she has a place to sit and be restful in between contractions. I also just love the bathroom and the tub and the shower because it is a nice private space. You know, it's like a room in a room, right? And so, you know, it really provides an opportunity for privacy, even sometimes privacy from some of the extra family members that have come to join them you know, in the birth. But a nice warm shower can really be soothing. And if there's a handheld shower head, then, you know, they can really direct also, you know, where they, you know, where they want the water to flow. And as much as I love showers, there is nothing like full immersion in the water. You know, during the first stage of labor, we know that you have, you know, less epidurals and shorter labors when we use full immersion in the water. Our tubs aren't the best either. I think I heard somebody mention they're kind of hard to get in and out of, and ours are too. But I have to say, totally worth it when you know, when someone can really get into them and fill it up with some nice warm water, and it's just really great. Barbara Harper, who is the founder of Water Birth International, talks of, you know, she travels internationally, educating on water birth. Really amazing if you ever have a chance to learn from her. The effect of buoyancy that deep water immersion creates allows spontaneous movement of the mother. No one has to help the mother get into a new position. She moves as her body and the position of the baby dictate. Movement helps open the pelvis, allowing the baby to descend. When a woman in labor relaxes in a warm, deep bath, free from gravity's pull on her body, with sensory stimulation reduced, her body is less likely to secrete stress-related hormones, and this allows her body to produce the pain inhibitors, endorphins that complement labor. Another strategy that we use is heat and cold therapy. So heat therapy might be a warm blanket, a warm gel pack, a heated rice pack, a hot water bottle, a warm moist towel on her abdomen, lower back or shoulders. And then cold is numbing, right? So so heat therapy can relax and help sort of like soften and stretch muscles and tissue, and then cold can be numbing. So that can also be helpful. So you can use an ice bag, frozen gel pack, cold moist washcloth. I like to use that, you know, when they really just seem to be working hard and sweating on their upper brow. Usually what I'll do is, you know, wet the washcloth with cool water. And then as it starts to warm up, I'll just kind of whip the washcloth in the air, and the cool air kind of helps you to get cool pretty quickly again. And I don't have to go back over to the sink and wet it again. You can even use a latex glove filled with, or a non-latex glove, I guess, filled with ice chips. And you can use that on the chest or back. We have some great gel packs now, but I do remember many a time using a glove full of ice as an alternative. So pain perception is lowered and muscle spasms decrease when cold and heat therapy are applied to different areas of the body. And as I mentioned, cold compresses can numb an area, and it slows transmission of pain and other impulses. So it does last longer than heat. And heat application raises the pain threshold, increasing circulation and relaxing muscles. I like this picture because you just see someone conveying that sense of caring, right? Like, you're not alone. I'm here with you. Got my hand on your shoulder. It really doesn't take much to convey that, like, caring kind of attitude. And, so touch and massage can really be as simple as a pat on the shoulder or hand. And obviously, we need to be careful because, some people don't want to be touched. And so we need to honor and respect that as well. And try and get a sense for what the patient's wishes are regarding, their personal space and their cultural background. That can all influence what they feel is appropriate. And there are a couple different kinds of massage that we can consider. Effleurage is one type of massage that's really like a light touch. It can provide a mental distraction. And mom can even do this herself, right? She can use her fingertips and just rub and stroke on her belly in a circular pattern. She can do this in the shower with the water, right? So that can kind of create a similar experience. Or her partner can do a scalp massage, right? So gently with just the fingertips on the scalp, like that just feels so good. And we can also do more firm massage. So you can rub her feet, her back, her shoulders, her legs. I find that most people don't want like movement during a contraction. They would rather have like a firm sort of steady pressure, and then between contractions, sort of like that gentle massage tends to feel good. But always wanting to stay like in touch with your, the laboring person, and just, ask them, how does this feel? Is this better? Is it helpful? Kind of getting feedback, from them. And so I have here just a video on some massage techniques that that you can use for lower back discomfort. I'm going to stop the share and we will watch that video now.
That makes sense. Okay, Nissa, are you ready?
I'm so ready, Joe.
Okay.
More massage.
So, if you imagine that Nissa is extremely pregnant and in labour,
It's just
and her
cheese.
tummy's around here, Christmas cheese.
Christmas cheese.
And obviously, this area, all of her body is working very hard in labour, but this bit of the lower back is directly in contrast to the pregnant abdomen, the tummy and the front. So it's great to relieve a bit of pressure in the back. So with oil or without oil, I'm going to show you without oil first. What might be nice to do is imagine a figure of 8, so the infinity shape, and just either with hands on top of each other or hands separated, just cover the lower back. So hopefully you can all see what I'm doing. I'm just swapping hands and making the number 8 with my hands. Does that feel nice, Nissa?
Yeah.
Now, some people will just need this amount of touch to get a little bit more into the massage. This is just some sunflower oil. I've just put a little bit of oil into my hands, and now they're oiled. Obviously, my hands are going much more fluidly and easily over Nissa's back. Does that feel nice, Nissa?
Yeah. Please get your partners to watch the video. Get them stuck in daily, I would say.
So you can alternate it between being one-handed and then double-handed like this. This can be really good in between contractions. Now, sometimes it can be good during contractions as well. And as Nissa just suggested, it's obviously very good in pregnancy. Massage is always good if you like being massaged.
It feels really, really relaxing.
If you want to alternate with this, then you could imagine you're kneading a loaf of bread or some cake mix or something. And you could just go like this. Does that feel nice, Nissa? So I'm just gathering up any flesh in the lower back.
My Christmas cheese.
The Christmas cheese, and I'm just kneading it. And then I'd move to the other side and do it on the other side. There's loads of techniques that I can show you for use in labour and in late pregnancy. And I do a session that you can buy as an add-on session to my pregnancy massages, where I show you different positions that are good in labour and some good massage techniques, nice and simple. So the only other thing I wanted to show you for this short video is to imagine at the bottom of the spine, we have the sacrum, and you bring your thumbs down until you feel a little bit of a hollow. And then you can use your thumb. I'll just take away one hand so you can see. Use your thumb on both sides and you can press it in. Now this can be really good to relieve discomfort or intensity during contractions. And I can't think of the many hundreds of women I have done this for as a student midwife and then as a midwife in the last few years. You can do that on both sides. Does that feel nice, Nessa?
It does actually.
So you don't have to be pregnant for that to feel nice. Now your thumbs can get a little bit tired, so you can alternate it with the palm of your hand like this, the heel of your hand just pressing down. I'll show you with this one, you might see better. The heel of your hand pressing down. Now you don't want to pulse this in, you want to push in and keep the pressure there, because I think it would be quite annoying to pulse in and out for a woman who's having a contraction. Do you agree, Nessa?
It feels very grounding.
Yeah. And there's lots of points in the body which connect to different areas, which can be good as well. We hope you enjoyed this little video. If you like it, we're very happy to make more. Bye-bye for now.
Bye, guys.
I love that the next video that they were promoting is reusable nappies. So cute. Excellent. Okay. So, and I think the next one is counter pressure, but that's basically what she was, demonstrating is using a bit of counter pressure there and the low part of the back. This is the double hip squeeze. The double hip squeeze is pressing on both sides of her buttocks, the palms of your hands, applying pressure towards the center. So sort of like pressing the hips together. You can experiment to feel like where that pressure feels best. And this is something that you can do leaning forward. I've done this on people who are just sitting on a birth ball or leaning over the bed. And this feels really good. If you start this, be prepared that she's likely to want to keep having it. And so it's definitely one of those ones where you want to teach the support person in the room how to do that. And it basically changes the shape of the pelvis and can release tensions on the sacroiliac joint. So it feels really good. Counter pressure, again, is what she just showed in the video, and that's pressing steadily and firmly in one spot in the lower back or buttocks. And So she was using, right, she used the palms of her hands, she used her thumb, and I've also used like, just kind of like my fists, sort of pushing, into that area. And it's really kind of like a constant pressure. And you could also use like a small ball. I didn't use a tennis ball. What is it? Like a racquetball, so because it's like wipeable. So I brought some of those, onto the labor unit. Some people will cut a pool noodle into pieces, like into like a small piece, and apply that to the lower back. You can also use a heat pad and apply counter pressure over the heat pad. So these can be really comforting.